Well, hi guys, welcome back to the Kneady Homesteader channel, and I'm sorry if I look a little rough, but I wanted to do a quick little update for you guys. I promised I would update. I know I'm so bad at usually doing that, but I know so many of you are keeping me in your thoughts and prayers, and I can't thank you enough. I am a big believer of the power of prayer. That's why I go to prayer meeting, well, every Wednesday night up until recently, to pray for other people and pray over other people, and it's just people prayed for me through this whole accident, and it has really made a huge difference. So thank you, thank you, thank you for those of you who are praying for me. I appreciate it more than words will ever be able to tell you. So my little update, I did get a CT scan, and unfortunately I have an infection in my leg. So the plan is to go in about a week. The surgeon, I'm going to have my surgery down at the University of Michigan with my original surgeon who saved my leg. So I'm in good hands. I'm going to the best of the best, and I have no doubt that he's going to take really good care of me. So we're going to go in. He's going to remove my hardware, which includes a rod in my femur. It goes from my hip bone down to my knee. I think it has 5 or 6 screws that attach that rod to my bone, and then I have a metal plate on the side, on the right side of my kneecap, that allows my knee to move, and so that plate will come out. I think I have 15 screws above my kneecap, and then I have one of my fractures is a bone that's right on my kneecap, and I think that has 3 screws in it. That has been displaced, so that has been moved, so that will need to be fixed. So they're going to go in, they're going to take out all the hardware, they're going to clean it out, they're going to remove any damaged tissue inside, and then they'll replace the hardware with all fresh hardware, and then they'll close me up, and hopefully that will be it. They don't know how bad my infection is until they get in there. So there is a chance that when they get in there, if the infection is worse than they thought, they'll go ahead, they'll remove the hardware, they'll clean it out, but then they're not going to replace the hardware. They're going to put in what they call a medicated nail. And I'm sure some of you probably know all about this. So if you have any advice for me, leave it down in the comment section for me. So they'll put in a medicated nail that will slowly drop out an antibiotic into my bones, my bone area, and then they don't know how long that will need to stay in for. It'll all depend on how bad the infection is. But once that is empty, they'll go back in on a second surgery, they'll remove that medicated nail, and then they'll replace my hardware. So worst case scenario, I'm looking at 2 surgeries. If I have to have the second surgery, I will be non-weight bearing because I won't have any hardware in my leg to stabilize it. So I won't be able to walk or anything like that. But the plan is to do this outpatient. He knows my trauma. He knows I don't want to be away from the kids. I fought so hard to get home to them, but I know this needs to be done. So his plan is to do this outpatient. He wants me to be prepared to stay one night, overnight. If the infection is bad, he said just to keep an eye on me. But he doesn't foresee anything longer than that. And then my recovery I won't have to go back to the rehab hospital to learn how to walk again. They're going to do, if I have rehab, it'll be outpatient. And he really wants me home to heal. He said, I'll heal faster, I'll heal better, and then I won't be separated from the kids. So, so that's the plan as of right now, is to get me home and get me healed. So I'm not sure how long the recovery is going to be yet. All of that will be discussed after the surgery, after they go in and see what they find. So all of that is kind of still up in the air. But I'll come back and I'll let you guys know. I don't want to release too much publicly till after the fact, unfortunately. But I will come back, I promise, and I'll give you guys an update. After the surgery, I will ask for prayers once I get to the hospital, just so that no shenanigans can happen beforehand. These are things that you always got to think about, unfortunately, when, you know, you put your face and your voice out there. So, but I will come back because I know many of you want to pray for me while I'm in surgery. So I promise I will come back when, before my surgery, and I'll let you guys know when I'm down in the hospital, and then any and all prayers. I can't thank you enough. It means so much to me, and it is truly what is getting me through this. My faith and knowing that the Lord has me. Like, I have not an ounce of doubt that he is going to pull me through this, and that I am in his hands, and he is going to be working through that surgeon, and he's going to put me back on track. The reality is, when they looked at the CT scan, not only did my fracture shift, but in the past 6 months, my 2 fractures that I have in my leg have not healed at all. My vitamin D is completely depleted. It's just, my body has healed an enormous amount of bones. You know, I had so many broken bones, a collapsed lung, you know, the head injuries, and my body now is just fighting. It's depleted, it's tired. So we're gonna help it out. My supplements have been changed, so we're gonna try some new things, and hopefully I'll be back on the road to recovery, and I'll be walking soon. And that's the goal, you know, is to get this leg healed and get back to doing the things that the Lord wants me to do. And so thank you all so much for the love and the support and hanging in there with me. I knew this would be a long recovery. It is, you know, you go through these bouts of just sadness because, you know, 15 months is a long time. And I just, you know, I'm a little tired. So, but the Lord is going to bring me through, and things are going to be good. So I have no doubt. So thank you for your love. Thank you for your support. Thank you for still, you know, cheering me on through this channel. I appreciate it so much, you guys. I'll never be able to thank you guys for what you've all done for me and for my babies. And so I promise you I will be back before surgery, and then I'll come back after surgery and let you guys know how it went and that I'm okay and what they found. And then I'll just kind of take you guys along with me as I go through this. So anyway, okay, I wanted to keep this short and sweet. I love you guys so much. Happy Saturday. I hope you're having a blessed weekend. I'm going to try to get to church tomorrow morning. It's been difficult because I can't move a whole lot with the infection in my leg. If I don't take my Tylenol, the fever comes back. And so I've kind of just been, you know, bed rest. That's kind of where they want me. They just don't want me flaring anything or making anything any worse than it is. So, but tomorrow, if I can get out of here and go to church in a wheelchair, I just want to go to the house of the Lord one more time before surgery, just so I can pray. So I'm hoping. So we'll see if I can make it out of here tomorrow morning. But I hope you guys have a wonderful, blessed weekend, and I will be talking to you guys soon. Okay. Mwah. Bye.